telescope capsule for delayed release. The name indicates a bilayered osmotic tablet is prepared which has one of the chambers containing drug with an orifice and other chamber contain osmotic engine. The filling of drug which is either performed manually or automated filling machine. These two layers are separated by a waxy material. The tablet is fitted inside the capsule in such way the osmotic layer faces towards the completed end of the capsule and the drug with the exit port faces towards the open end of the capsule. The cap, bilayer tablet and body are fitted tightly. As the water imbibed in the housing of the dispensing device, the osmotic engine which is expands by the applying pressure. Consequently, there is no agent is delivered for the delayed period of time. This is about the telescope capsule for the delayed release. It takes long time to deliver the drug. Longitudinally compressed tablets. These are the longitudinally compressed tablets. It is advanced design which contain osmotic layer can be configured to contain several drug layers. The multiple drug layers provide increased flexibility and to control the pattern of the release of medication system. The single layer opposes the another layer. The delivery of drug is in the form of zero order fashion. For example, two drug layers could be formulated with different drug concentrations to provide the modulation in the release of profile. When the release of two drugs at its same time, it doesn't affect any therapeutic value. So, that's why the drug layers are two types. First, the delivery of drug will be from the layer 1. After that, the drug will be released from the second layer. This is about the longitudinally compressed tablets in the multi-layer formulations. You can observe here the drug layer components can control the amount of mixing and multiple drug layers. These drug layers allows the greater flexibility to achieve the target release profile. These longitudinally compressed tablets are formulated as a multi-layers to formulate within different drugs to provide the combination of therapy to cure the disease, to cure the different types of diseases at a time. These type of medicines, these types of drugs are formulated, but it doesn't have the proper therapeutic value. It is very slow therapeutic value will be shown because here having two layers. It is very slow process to release the drug into the body. So similarly to push or pull system is there. The delivery of drug which can be unaffected by the gastric pH and presence of food which is depend upon the gastric tract to release the drug. colon targeted oral osmotic system. These colon targeted oral osmotic systems are used as a once or twice in a day. It is single osmotic agent which is comprised to pass 5 to 6 push-pull osmotics in a hard gelatin capsule. These osmotic units are coated with the enteric coating. After coming in contact with the gastric fluids, the gelatin capsules will dissolve in the gastric fluids. The tablet will remain in the gastric intact. As this system enters into the small intestine, the enteric coating dissolves and water is imbibed into the core, which causing the compartment to swell. Here nothing is there because the layers are dissolved in their gastric fluid or either in the small intestine. The coated layer will be dissolved in the gastric fluid and some enteric coated tablets are dissolved in the small intestine. At the same time, the flowable gel is formed in the drug compartment which is pushed out the orifice at precisely controlled by the rate of water which is transported across the semi-permeable membrane. This is the colon targeted oral osmotic system. And sandwiched osmotic tablets. It is composed of a polymeric push layer which is between two drug layers within the two delivery orifices. So that's why it is named as sandwiched osmotic tablet. When this tablet is placed in the aqueous environment, the middle push layer which containing swelling agent, it imbibes with the water and forming the surrounding areas via semi-permeable membrane. The drug release from the two orifices can be observed. This is the sandwiched osmotic tablet. The delivery orifices are placed two types and drug layers are two, and this is the semi-permeable membrane to release the drug into outside of the drug delivery orifice. And monolithic osmotic system. It consists a simple depression of the water soluble agent in polymer matrix. When the two systems comes in contact with the aqueous environment, the water which is connected by the active agents while the rupturing can be takes place. Initially in this process, the outer environment of the polymeric matrix gradually proceeds towards in the matrix. However, this system fails if more than 30 to 40 units per liter of the active agents which are incorporated into the device, as above this level significant contribution from the simple leaching of the substance can be takes place. Controlled porosity osmotic pump. Here, this is widely investigated osmotic pump which contains single or multi-compartment model. It contains a drug and osmogen which is surrounded by the semi-permeable membrane. This semi-permeable membrane is selectively having water, but It contains a intensive pore which is formed with the additive dispersed wall. The sponge-like structure is formed in substantially permeable to both water and dissolved drug agents. Rate of drug delivery, which is depends upon the factors like water permeability of the semi-permeable membrane, the formulation, thickness, total surface area of the coating. All these variables are comes under into the physiological conditions, that is like pH and intensity. These are the drug delivery of the osmotic pump within the body, which is released into the porosity to control this system. The osmotic pump, which is imbibed with the controlled porosity osmotic pump, is used. This is about the classification of the osmotic drug delivery systems. In previous video we will discussed about the some types of classification. In this video we are completely known about the osmotic drug delivery system. Thank you for watching. Please like and share to my channel. Please subscribe to my channel and hit the bell icon for more notifications.